House provided a budget outline that experts warn would almost certainly result in cuts to Medicaid, which helps ensure lower-income Americans. This comes as President Trump says he will not support cuts to Medicaid, Medicare, or Social Security.
Meanwhile, lawmakers here in Wisconsin are debating a plan to expand Medicaid locally. Political reporter Will Keneally is at the Capitol with the latest.
Health care should not be a privilege afforded only to the healthy and wealthy. It's why I am again proposing to expand Badger Care.
That's Governor Evers from last Tuesday, announcing a plan in his state budget address to expand Medicaid coverage to more Wisconsinites who make less than the median household income for the state. So Wisconsin is one of a handful of states that did not expand Medicaid under Obamacare or the Affordable Care Act. But Wisconsin did take the unique step in partially expanding Medicaid coverage to 100% of the federal poverty level, meaning that anyone making around roughly $31,000 per year or less would be covered here in Wisconsin. Now, Governor Evers in his budget wants to increase that to 138% of the federal poverty level, meaning that anyone making roughly $43,000 annually or less would be covered under Evers' expansion there. Now, this would also cover the median household income for Wisconsin, which sits at roughly $42,000. Now, according to a new report from the conservative Wisconsin Institute for Law and Liberty, that report questions the benefits of expanding Medicaid here in Wisconsin, and that was something that Republicans touted earlier today.
Once again, Wisconsin has made the right decision by not expanding Medicaid.
While the governor says federal money coming in to support a Medicaid expansion would make this cheaper for Wisconsin, Republicans argue that taking that chunk of Wisconsinites out of the private insurance marketplace would raise the costs in that system.
So by keeping the expansion from happening in Wisconsin, we have had no individuals, or almost none, who don't already have access to health care, but we have ensured that we don't increase the cost on the private sector.
Reporting from the state capitol, Will Keneally, News 3 Now.
The state lawmakers are expected to remove the governor's Medicaid expansion proposal when they take over the state budget process this spring.